I'm Dr. McKinney, and I'm just showing a basic foot exam. This is a good exam for providers to do, and it helps to satisfy some of the requirements needed in our documentation. So what I'm going to do, the first thing for every diabetic patient, the best thing to do is to have them come in and take off their shoes and socks. That way you get to cover that first item, which is called the visual exam, and you're seeing what their feet are looking like. The next part of the exam is the sensory exam. In many of our clinic locations, we have Sims-Weinstein monofilaments available, and with these you can do a really quick exam. Now, when the best thing for them to do is, of course, to come see me in podiatry. However, this is something quick that you can do, but it's efficient, but it still gets the job done and gets a good initial evaluation for their feet. So you just take the monofilament and you press it until it bends slightly. This is about 10 grams of force that's applied, and this is a good test to check for loss of protective sensation. So one of the things that's really important with diabetic patients is that they can end up with amputations, and we want to prevent amputations at all costs. So we want to see, can they actually feel this 10 grams of pressure? There are at least 10 different locations on the foot, but to just to kind of do a very quicker version of that, you can just keep it to the toes, because those are the areas that often have the deficiency. You can do toes 1, 3, and 5. The next part of the examination is motor testing. So you want to check to see, can they push against you and feel, not just, you can feel the different types of levels of strength. Are they weaker on one side than the other or not? So I'm going to have my model demonstrate that. So push down against me and pull up. Okay, very good. So that, again, is another exam that you can do. And then the next one is checking their pulses. So just checking the two main pulses on the foot, the dorsalis pedis pulse and also the posterior tibialis pulse. And those are two areas that you can check, and that also satisfies another one of those portions in the exam. There's one other thing that I forgot to mention. When you're using the Sims-Weinstein monofilament, you want to, as you press it in, you want the patient to say, have them close their eyes, and you want them to actually tell you if they can feel it or not. So you test them on a higher part of their foot or ankle, and then you say, can you feel this? Mm-hmm. Okay, and then you ask them to close your eyes and say yes every time you feel me touch your feet. So we're going to do that. Mm-hmm. 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 Okay, so my model is able to actually take care of this and satisfy, and he has good sensation in his feet. And that is a really great way of doing a foot exam. And mainly for every diabetic patient, they should see their podiatrist at least once a year. Many other times they should see them more often. And this concludes my examination. It's a demonstration of a foot exam. Again, you want to make sure that they see their podiatrist at least once a year. And if you see anything urgent that is necessary, I am available at least 4 clinic locations currently. So you can send them to me and I will take care of the rest. Thank you.